welcome to the Mama Stay Fit week by week pregnancy update. We are at week 17 now, and you're going to learn what is going on with your baby, what's maybe going on with you, and then also what's going on with me, because I am in my 4th pregnancy and I am navigating this journey with you. So if you are pregnant, be sure to comment below to let us know how you are feeling so we can connect with you on this journey as well. So Roxanne, what is going on with a 17-week baby right now?
17 weeks. Baby is the size of a cassette tape. For you that do not know what a cassette tape is, Gina, what is the size of your baby?
It's the size of a pomegranate.
Yeah.
But even sweeter is what my app says. But a cassette tape is like this big.
This is a cassette tape.
We used to have Walkmans before CDs, before MP3s. So
probably the size of like the original iPods. Like
old school,
it was first generation iPod, I think is like the cassette tape.
I used to have to have like a cassette tape that I would put in my car
for Bluetooth
to then hook up to my iPod to listen to music.
Life has changed and now it's just CarPlay. I just walk into my car and it plays music.
Gen Z, or I guess, Gen Z.
Gen A or Gen Z.
Does Gen A should not be having babies yet.
They should not be
if you were Gen Z, just Google cassette tape.
Yeah. No, we'll put a picture. This is a cassette tape. All right. So other than baby being the size of a cassette tape, things that are happening to baby this week is their bones. At first, they're just cartilage. So now they're starting to harden and become actual bones, which is kind of cool. Their sweat glands are starting to develop as well. So they can't obviously sweat, but like they're getting ready to get their gains on. So those are developing. One day they can then sweat on the outside. Their umbilical cord is also furthering their development. So it's getting longer. So it's already fully formed, but it's just getting longer as baby gets bigger as well as thicker. We had already talked about what's inside umbilical cord. It's those veins and the arteries. The vein is how baby is getting their oxygen and nutrients. And then the 2 arteries is how all of the waste is being taken away from baby to the placenta to be filtered out.
Don't arteries bring blood and like oxygen to us?
So it is opposite in a way from what our blood vessels do. So the veins in our body is what brings like the unoxygenated blood back to the heart, whereas the arteries is where the oxygenated and nutrient-dense blood leaves and goes out to all of our distal extremities and other vessels. So it is slightly opposite, but if you think about the vein is what is like going to the baby's heart, whereas the artery is going away from the baby's heart, it's similar. But like what they're doing is a little different.
It's our blood that's oxygenated that's going to the baby. Okay, that makes sense to me. Thank you.
Baby's also continuing to move and like practicing their sucking and their swallowing. So again, then when they come out, they know how to eat. You might start to feel movements again if you haven't yet felt them. They might start like moving more. You're obviously not going to feel when your baby is like practicing swallowing. That's not a movement you're going to feel. But you should feel when they're like kicking and punching you in the belly, which is great. You do not yet need to do fetal kick counts yet, though. If you start to feel baby's movement, you can start like noticing when they're more like active than not active, but you don't need to like count and sit there and like count their movements until like closer to 28 weeks. But if you start to feel them, you can like acknowledge that they're there. And if they all of a sudden are not there, then maybe call your provider. During this time, so we started talking a little bit about the genetic screenings last week that might start to be offered to you. Now you're in that like 15 weeks to 20 week window. If it hasn't yet been offered to you, it will probably be offered to you for genetic screening. There is a difference between genetic screenings and genetic diagnostic testing. So everyone is offered genetic screening, but if you come back with like risk factors, so it's like a positive screening, this doesn't mean that baby has any genetic anomalies or chromosomal anomalies. It's just baby has like some risk factors that it could increase the risk of baby having them. So they will always recommend diagnostic testing. So if your provider says either of those things, that's what they mean. So screening testing is screening for risk factors. Diagnostic is baby has whatever they're testing for. So other things that are happening to just you, 17 weeks pregnant, is that you might start having, like, you probably already have it, the pregnancy glow and the mask of pregnancy. This is from like the increased blood flow throughout our body. So it's like people have like that beautiful glow. It's also like hyperpigmentation of our bodies starts happening around now. So this is due to the progesterone increase. So you might have what's called the linea negra, which is like a darkened line from your belly button down to your pubic bone. Some people don't get it. I got it every time. Also, your darkening of your areola. Some people will start to have just like pigmentation on your skin as well. So like brown spots might develop around your skin, or you just might notice different like coloring within your skin if you have like darker skin tones. And this is again just due to that progesterone. So it's like bullseye for when baby comes out for nursing, and then hormones just doing great things to our bodies. Most of us should hopefully our morning sickness should have like alleviated. If it's still if it's still present at 17 weeks, unfortunately you might have something called hyperemesis gravidarum, which just means you likely will have nausea for a large majority of your pregnancy. It is not enjoyable, if you can imagine. The severity of the hyperemesis gravidarum, there is a spectrum where like some people it's just like constant nausea for your entire pregnancy, whereas other people it's constant vomiting where like you're at risk of dehydration as well as like nutrients for your baby because you just can't eat anything. And treatment will kind of dependent on the severity of that hyperemesis gravidarum. If you do find that you are still very, very sick at 17 weeks, reaching out to your provider to see about different treatment options can be really beneficial because we want to avoid being dehydrated and malnourished during our pregnancy because that can affect baby. You might start having round ligament pain if you haven't yet from just that uterus, because this is the time that baby is like rapidly growing in that second trimester. So you might start having some like pelvic girdle pain, some uterine ligament pain. So if you feel that you have that round ligament pain, you can check out our round ligament exercise video that we'll link below. And then you might also start feeling as early as 17 weeks, these practice contractions or Braxton Hicks, which is irregular tightening of your belly. And it could happen like just out of nowhere. Your belly is just all of a sudden really tight. It should not be painful and it should not be regular. So if you start noticing that it's like tightening at like a rhythm where it's like tightening, relaxing, and then like a couple minutes later it's tightening again and relaxing, and it's staying like that, that would be a concern to reach out to your provider because that could potentially be early labor. Preterm labor at 17 weeks. If you notice that it tightens and it relaxes and it like maybe like a while later it gets tightened again, especially if you're like doing certain activities. So I found that I would have it when I would exercise, but it would go away at all other times. That could be normal, but always bringing these things up to your provider can be really, really beneficial because we want to avoid preterm labor and delivery if possible.
I would say for me, the difference between like a Braxton Hicks contraction and like a labor contraction is that a labor contraction intensity changes throughout. So it'll start low, it'll increase in intensity, peak, and then release and let go. So there's a change in intensity throughout the duration of the contraction, while like a Braxton Hicks was like a sudden tightening and then a sudden release. There wasn't really any sort of build. So I would almost compare, for me, because everyone kind of describes contractions a little differently, I would compare it similar to like a Charlie horse in my calf, which are some things that I think I'm starting to experience again, which is really fun. I need to drink a little bit more water and magnesium, where you feel like Charlie horse coming in your calf and it's like starting to build, like you wake up and you're like, no, 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 as it peaks and tightens and you're like, and then it like slowly releases, but you still kind of feel it. That's how I would describe a contraction. Not that labor is like endless Charlie horses, but it's like that build, peak, and then release, kind of like a wave. So those are different than Braxton Hicks, which are just like sudden, gone. Like there's no build up, no peak, and no like release that happens. So that's usually how I can tell the difference between the two as well. But again, if you're ever concerned or you're not sure what you're feeling, because most of us have never felt a contraction before, especially if this is your first pregnancy. And then even if it's not your first pregnancy,
Every labor is different. Every
you trick
pregnancy is
yourself
different.
and you forget everything and you're like, is this labor? It can always be really helpful you could even just call like the nurse hotline at your hospital or your birth location just to ask a question and be like, I'm not sure what I'm feeling. And they can kind of talk you through an assessment to figure out, should I be concerned right now? And then see if you're like, even if you're 17 weeks and you're like, I don't really feel my baby, like I'm concerned, like calling and asking like, hey, like, how concerned should I be? Like, it's always good to just seek out support from your medical team and your provider if you have questions, as opposed to sitting with anxiety about it. If you feel like you can wait until your next appointment before you ask the questions about things that you're concerned about, and that feels safe to you, like that's a great option as well. You can write them down, like put them in your phone to make sure that you have all the questions that you want to ask. Because sometimes you just forget like the random things that you were like curious about. Like, can I eat this? Like, is it okay if I do that? Like the questions that you just have during your pregnancy, annotating them down for you and your partner can be really beneficial in preparation for your prenatal appointments.
So Gina, how are you feeling in your 17th week of pregnancy?
My energy levels have been fluctuating, but I feel like I've also been a lot more active too. Like I've been doing a lot more because I had so much energy that I have like fatigued myself completely. So I'm like really tired again. So my energy levels are kind of ebbing and flowing as each day goes by. So I just try to acknowledge how I'm feeling and being okay with doing a little bit less if I am feeling more fatigued, which then becomes a struggle of like feeling guilty for not being productive, but you're growing like a human being. And so it's like this balance of like accepting and validating myself and how I feel, but understanding that it's okay to rest and that I'm allowed to do that. So that's something that I've been experiencing. But in addition to not being able to rest, I also have not been able to sleep, which probably is what is really contributing towards the fatigue that I feel during the day, because I have a little bit of pregnancy insomnia. So usually I wake up at like 2 or 3 a.m. because I have to pee, which you should only have to pee like once a night during pregnancy. If you're peeing more than that, you should work with a pelvic floor physical therapist, because any more than that is potentially a sign of pelvic floor issues. But so I wake up my one time a night to pee because I'm very well hydrated, but not hydrated enough to prevent Charlie horses, which they're like, you know, when it's like kind of like the inkling of it, but it doesn't happen, where you're like, I need to hydrate more or else this is going to be bad for me tomorrow. So they're not like full blown yet, but you kind of feel it. Like it's,
You should try the sleep and relaxation support.
I should.
Needed.
So I've been having some pregnancy insomnia. After I wake up, I kind of like lay there for like an hour or two before I could finally fall back
Do
asleep.
you play on your phone when you wake up?
No.
Okay, I got
I
nothing.
just lay there and think about the life of that I'm growing. I don't know what I'm doing. I just lay there and I'm like, why can't I sleep? So I've been trying some different things. Certain things I have found to be helpful for me. I've been doing a cherry tart juice mocktail with some ginger beer at night, which is non-alcoholic. I drink that because
like root
the
beer
cherry
with ginger?
tart juice has something that helps you sleep in it. I don't know what it is, but I've also been drinking casein protein before I go to sleep, which is a slow release protein. And so you drink it before you go to sleep.
So it helps with the blood sugar
And then it
regulation.
helps with my blood sugars all night, which is something that you have been telling me to have a snack to help with my blood sugar. And I've ignored you until somebody else told me.
Sounds about right.
To do this protein. So I did that, and so I did both of them at the same time. I was like, should I only do one at a time to see which things help the most? I'm going to do them all. I also took like a Epsom salt bath that was for insomnia. I think it just has a lot of magnesium in it.
So it's like double magnesium.
Yeah, I don't know. It's a special brew, which I wonder, because you said your energy ebbs and flows. I wonder if maybe some days you have too much magnesium and other days you don't. It's probably the lack of sleep that is doing it. So those are the things that I have found to be really helpful. So if I do those things, I don't do all three of them every night, but I usually do the cherry tart juice mocktail with the casein protein, and that usually like really helps me sleep through the night, or even when I wake up, I can fall asleep pretty easily. The nights that I don't do it, I usually lay there for like an hour or two. So
Eat a snack.
yeah. So I gotta have some snacks by my bedside. So that's like the main thing that I'm dealing with this week, is try to sleep more so that I can have more energy again. Because I liked having lots of energy.
I mean, we all like having energy, I think.
But overall, like feeling pretty comfortable with the pregnancy. I've had some on and off round ligament pain here and there that I've been doing some movements to help. I do a lot of like hip flexor releases and massages. We do have a round ligament workout that's free on our YouTube page that we'll link below that you can check out as well. This is the movements that I've been doing during my pregnancy to help with it. Also seeing a Webster certified chiropractor because they kind of address like the uterine ligaments and pelvic balance. And so he helps to kind of release the hip flexor round ligament area. And then my massage therapist does as well. I spoil myself during pregnancies and I get massages every 2 weeks because I'm growing a human. I deserve it.
If you need us to tell you that you need a massage during your pregnancy to have a better pregnancy, we tell you that now.
That is me telling you that.
If you needed somebody to tell you that, we tell you that now. Massages are great during pregnancy.
They are. And so she does like a belly massage for me, and then also like addresses like
the belly massages
round
are
ligament
so nice.
and hip flexor stuff, which has
Broad
been
ligament
really
too,
helpful.
probably.
Yeah, which has been really helpful for the comfort that I've been feeling. I haven't had any pelvic pain yet, which hopefully I won't have any. I think usually I started feeling some at this point. But I think all of the pelvic stability work that I've been doing with the prenatal fitness program has been really beneficial as well. And so if you want to work out with me during your pregnancy, you can check out our prenatal strength program, which is our 40-week program that syncs to your current week of pregnancy. And we've got strength exercises with it, accessory work that's focusing on pelvic stability, also pelvic opening and pelvic floor work. And it's a daily workout that you can do. We also have a mini version if you just don't have an hour to work out, which is, I think most people don't have that much time to work out. We have a mini version, which is only 15 to 20 minute long workout. And then we have on demand as well, which that also might be contributing to why I'm so fatigued is I've been filming a lot of on demand videos, which are the full length workout videos that you can follow as you work out at the same time. So lots of options available to you if you want to work out with us during your pregnancy. It's never too late to start. You can be 17 weeks and start. Our program sync to your current week, so you can start at any time, and you can still reap tons of benefits of exercising throughout your pregnancy for both you and for your baby. And if you want to check out any of our online fitness programs, you can use code YouTube10 to get 10% off, and you can bundle it with childbirth education and pelvic floor prep. Those bundles are already 15% off, so when you add on the 10% off code, it's 25% off. So it's pretty much free.
We're just like giving it away.
Pretty much free
Giving
at
it
this
away.
point. So thanks so much for watching the week 17 update on what to expect during your pregnancy, how I'm feeling during my pregnancy. Hopefully the things that I'm dealing with during my pregnancy and kind of the tips and tricks that I'm figuring out are beneficial for you. If you have any tips for pregnancy insomnia, please drop them below and I will graciously accept and add them to my research that I am doing of all of the things to help you sleep better at night so that I have that second trimester energy again. So if you're pregnant, be sure to comment below. Let us know how you're feeling. If you have some pregnancy insomnia tips, also let me know those as well. And we'll catch you next week for week 18.